Hello, and welcome back to another episode of Your Wise Self with Sara. If you've ever felt like something in your body is shifting, your energy, your hormones, your sleep, your mood, and your doctor tells you everything looks normal, today's episode is for you. My guest is Dr. Yi Song, and she shares what most conventional medicine misses. Dr. Song grew up in Beijing, China, coming from a remarkable family with 17 generations of Chinese medicine practice. She came to the United States 28 years ago to study pathology at Brown University, and what she observed inside conventional medicine sent her back to her roots. In 2004, she opened a holistic clinic in Boston, and in 2018, she founded the Zenerchi Retreat in Medellín, Colombia, where she now offers some of the most advanced regenerative treatments in the world, including stem cell therapies not available in the United States. In 2020, her own mother received a stem cell treatment at age 81 and regained her independence. That moment crystallized everything for Dr. Song and what she believes about healing. She's the author of Regeneration Effect, Sacred Wisdom for Staying Young, and her mission is to combine stem cell therapy, traditional Chinese medicine, and anti-aging medicine to help people live long, high-quality lives. For women in midlife especially, she offers something rare, not more advice, but more clarity on what is driving the changes in your body and what you can do about it before small imbalances become bigger problems. Dr. Song, welcome. I'm so glad that you are here. It's great to have you.
I'm so happy to be here. I always like being on shows talking about health and longevity, which is my passion and
Yes,
your passion as well.
yes, absolutely. I'm so looking forward to this, and I know my audience is going to absolutely love hearing from you and the work that you've been doing. So before we get into the science and all the strategies behind the work you do, I just want to start with you. Your background is unlike anyone I've ever interviewed before, so I would love to hear more.
Sure, I grew up in a family with a lot of medical influence, both on Eastern medicine and Western medicine, and I was always attracted to Eastern philosophy since I was a child. So that's why I initially wanted to pursue a career in Western medicine because I thought Western medicine is more advanced, is more developed. So I thought if I study the mechanism of disease in Western medicine, then I can solve the fundamental root cause why people get sick, why people get aging related conditions. But then after I really studied it, that's why I came to the United States to study it. And I realized the approach in Western medicine really cannot solve a lot of health problems for people because it only treats the symptoms and only treats the symptoms when they arise and don't treat the root causes even when you have the symptoms. They just mask the symptoms or alleviate your symptoms a little bit, but never really treat the root cause to solve why you have these problems.
Yes.
So that's why I switched my perspective and went back to my family's traditional Chinese medicine route because I feel in traditional Chinese medicine, in ancient Eastern philosophy, we always try to address the root cause of the problems. And then that actually can make people live healthier with longer health span instead of just purely extending the lifespan.
Yes, absolutely. And I'm a big fan of Eastern medicine. I myself have a background in yoga therapy, and I can see where Western medicine has a place at the table. But Eastern medicine, as you said, it really does help get to the root cause. And I'm so excited to hear more about your work and how you have brought that into what you're researching and what you're implementing with your own patients. So you mentioned Chinese medicine. You've had 17 generations in your family of Chinese medicine practitioners. What was it like growing up in that household?
So because my family, like generations up, were all practicing Chinese medicine, but then my grandparents on both sides, they actually study Western medicine.
Oh,
When I was a child, most times I was pretty healthy, but then I also had some problems. And when I was 6 years old, I actually developed a kind of kidney infection, acute kidney infection. So I recovered from that, but I also had certain conditions years after that, not particularly related to that kidney infection, but then because I had that episode of kidney infection, so my parents were very cautious. Of course, I got the kidney infection partially because my parents at that time didn't really pay attention to my staph infection on my skin, so that's how I developed that. So they became really cautious, and then every single time I got sick, they would put me on antibiotics because they just afraid it's going to trigger my kidney infection again. And then the antibiotic most times didn't work for me. I would have coughing for a month after I got any flu or cold. And eventually I had to go to Chinese medicine doctors to get some kind of herbal formula. And usually, if I take the herbal formula within 2 or 3 days, my lingering cough was gone. So that's how I knew in this kind of condition, it really worked for me with Chinese medicine.
yeah.
And then my aunt, my mother's older sister, had a lot of problems. So she was very into doing all kinds of qigong, massage, Chinese medicine, herbal thing, acupuncture.
Yeah.
So then she would have a lot of these masters she studied with or she interacted with coming to our house, giving her treatment. And then sometimes I would get treatment too. And then I would talk to these masters about tea, what is tea? So I was only maybe about 12 years old and I actually started practicing Qigong and I really got to a certain stage. So
Yeah.
that's how I understood Qi really exists. It's
Yeah.
just we don't have any measurement in modern science to say what it actually is, but it exists, right?
I understand it, but if you wouldn't mind explaining for the audience what chi is, that would be great.
So Qi actually we can say is a kind of energy that's in the universe. So every human being on Earth, they have their own Qi energy field. And then their energy is also interacting with the cosmos energy, the universal energy. And then human being is the conduit between the universe and the earth. So that's why human being has to be in harmony to the universe and earth. So that is one of the important principle that I also wrote about in my book, Regeneration Effect, because if you try to think human can conquer everything and then human doesn't need to follow the natural rhythm and you don't need to follow the energy between the universe and the earth, then you will definitely get into some trouble if
Mhm.
you do that for a long term. So basically, we don't have any measurement for T right now, but it does exist and it surrounds us. So that's why even when you have, say, electromagnetic field interfering your energy field, then if it's strong enough, it actually can disturb your body's natural rhythm.
Sure. Yeah, absolutely. Einstein proved that energy is real. And so we can look to him for physics and that type of thing to understand that energy is real. And when we look to Eastern, just like you said, there's this chi that's inside of us. We have our chakra system that is energy based, meridians, those acupuncture points, all those areas within our body that really, when people start to study this, they will see that this is real and people can take a closer look at their own energy and what they're putting out. And so, one of the things that I oftentimes will work with women in midlife on is honestly just something really simple, like even accepting a compliment, which is so hard for us, but it's like this energy deflection when we say, when we dismiss a compliment. And so it's like that energy of allowing that compliment to come into our energy field and boost us up in a positive way. So that's a really oversimplified way for me to explain energy to people, but I love that you included that in your book. You came over to the US, I think it was about 28 years ago, and you studied pathology at Brown University. So you mentioned that you needed to go back to your Chinese medicine roots to find the root cause of disease. But how do you feel like those two maybe merged together today for you?
Yes, I came to US to study the advanced technology in molecular biology, cell biology. So I was very well versed in culturing cells, doing molecular study. Then I thought I really liked the macro approach, the root cause, the harmony approach in Chinese philosophy and Chinese medicine. Then I've been practicing Chinese medicine in Boston for the past 25 years. And in my process of treating people with Chinese medicine, helping them to either helping women get pregnant or helping people with a lot of pain condition that cannot be solved by pain medication, steroid injection, or a lot of other treatments, I realized that people, even when they seek Chinese medicine for conditions they do not have any solutions for with Western medicine treatment, they are actually still thinking they're how to approach their health in the Western medicine way. So they only come to you when they actually already ran out of a lot of other solutions. They don't have any other choices. And then they only wait until the symptoms are really bad. So they don't really recognize the body's early stage of imbalance to address that.
Yeah.
And a lot of people in their mind, they think, oh, as long as I eat healthy, I exercise, then I should be able to prevent disease from coming. That's not the only thing you do because our body is always aging. And we also have inherent deficiencies, weakness, or excess from our birth. So we need to address all those things to make our body in harmony. And we also talked about earlier about the qi. So for everybody, every single woman, every single human body, we also have the energy flowing inside each person's body throughout the channels. So if we have any blockage in that flow in the channels, that over time can manifest as a lot of conditions. But then if we don't recognize in the early stage when there is blockage and we don't address to unblock the blockage in the channel of energy flow, then that's when over decades of time, then we will have serious health conditions rising up. So it's not just about eating healthy and exercise. Those two are important, and having good sleep is important, but we also need to recognize our bodies, each unique constitution, and to address our imbalance in the early time.
Yes. Oh my gosh. You said so much there that I would love for the audience to learn more about. First of all, a blockage. I believe that blockages can be things that we've brought generationally through and
Yeah.
also things that can happen in our own lifetime. I'm curious if you wouldn't mind sharing. You have a situation that you can share with a patient that you've seen a blockage and what that might look like for someone.
So when we talk about blockage, a lot of people they don't really understand. Doesn't mean I just have some kind of blood clot or something or lymph system not flowing. But actually, in the energetic aspect, blockage can be the result of emotional stress.
Yeah.
So that's why the other principle about how we address our health, how to make our health better, aging better, it's really the most important thing is about the emotional well-being. And of course, right now we started having more conversations about mental wellness, about how to address our mental stress from our everyday life. But still, it's not that in-depth discussion about any kind of emotional stress or daily stress from your daily activities, just regular family life or work, if you don't know how to alleviate that stress inside of you, a lot of times it really can cause the blockage in the energy flow. So a good example of if let's just see whether do a self check whether we have that kind of blockage is a lot of people they have minor anxiety. And then when they do feel anxious, they will have cold hands, cold feet. So think about that. Why do you have that? That's because you have certain blockage in the energy flow and your hands and feet are the extremities.
Yeah.
So they're far away from the heart. So of course the energy flow, blood flow, lymph flow, they also overlap. The energy flow, Qi flow, is not just simply about the blood circulation, but it does drive the blood circulation. So when you have blockage in the Qi flow, energy flow, then when you have blockage, then you don't have the good blood circulation to supply the extremities. That's why when you have minor anxieties, you may experience cold hands, cold feet, and you may also feel sweaty palms, or you may feel some palpitation. So that's all signs of some emotional stress or energy blockage. So we need to address that so that we don't have that accumulated over time to affect our physical health.
Yeah. Oh, that's so interesting. And I never knew that. It's one of the things that is part of my story is extreme anxiety that I've dealt with over the course of my lifetime, that I've been an avid meditator, and that's helped me so much. I'm curious then if you have somebody come to you that's having anxiety, cold hands, cold feet, what would be the first step that you would take with them in order to help them?
So the first step, like of course, a lot of people, if they come to me with cold hands, cold feet, then I will tell them what this is and why we look at it this way in Chinese medicine. And then I will tell them you probably need to learn how to address the stress better, learn how to meditate better. So that's just through the talking. But sometimes, as a health coach, that even though you tell people all these things, it's very difficult for
Yeah.
somebody to implement all these in the real life. So they have to be reminded again and again. But then sometimes we see somebody one time or a few times and then we don't see them again, right? So we don't know what's going on with them. But if we raise the awareness, and then if we have enough information out there to keep reminding them, then that's one of the reasons why I want to publish my book so that they have a book on their coffee table, then it can remind them about all these principles. So then I think that will help people to think about, oh, I do need to do this. Oh, I have cold hands now, so let me do some breathing to relax myself.
Yes, exactly. And it's so interesting because I get a lot of women coming to me that don't realize that they have this low level, kind of constant hum of anxiety or stress just in the background. And that's become their norm. And so they don't really even notice that it's there anymore. And so, yeah, self-regulation and working into some intentional breath practices, intentional times of meditation, and even if it's a walking meditation, sometimes it's hard for people just to lay down during the day or do a meditative pose, if you will, but helping them really tune into that. So getting that mind body awareness. And you talked about constitution. So I've done a lot of work in Ayurvedic medicine also. And so I know they're very similar in concept, Chinese medicine and Ayurvedic medicine, of having constitutions. There's three different types of constitutions. And I actually introduce that to my clients as well, oftentimes helping them make tweaks throughout their day and their schedule. And then, of course, things that they might be eating that might not be helping. Is there anything that you would want to add about constitution work? I know we could probably do a whole podcast just on that alone, but is there any note that you would want to make on constitution?
Like you said, you study Ayurvedic medicine, and then in Chinese medicine, we have maybe 5 or 6 different types of body type from birth. So if you recognize your body's constitution, then you can address the weakness inside your body so that the weakness is now too weak and doesn't show the symptoms. So an example of myself is I was born with digestive system weakness. So even nowadays, I still have that weakness. It's not like it can be completely eliminated. But what I can do is I can modify my lifestyle and even do things to address that issue if it does cause some minor symptoms. So a perfect example would be recently I started having I already treated it, so I don't have it right now anymore. But starting last year, I started having some coughing things without even having cold or flu. And then I did get cold last October, and then this cough just didn't go away. And like I mentioned earlier in the beginning, when I was a child, I also had this problem. And then I would always take the Chinese medicine herbal formula that I know that works for me. But this time, even though I took the herbal formula, I still had the cough. So what was wrong with me? And then finally, of course, this is also merging Western medicine with Eastern medicine. So I went to a throat doctor because I didn't know what was wrong with me, and I already checked the lung, no problem, everything. So she actually said, "Oh, because you have silent, uh, because I don't have any acid reflux or heartburn," but she said I have silent acid reflux. So
Oh,
because of that, even though I don't feel anything, but because it's irritated my, and then that's why I would have this coughing several
okay.
times a day. And usually it's when I wasn't doing anything.
Okay.
Because if I kept talking or something, doing podcasts, I would not have any cough 2 hours. But then once I relax, like sitting in front of the computer or just looking at something, then all of a sudden I feel this ticklish. So she said, because I had this silent reflux that I never had any symptoms, then it irritates my throat. And then because of that, then also because I became 50 years old last year, so then the valve wears out.
Okay.
So so then, of course, in Western medicine approach, they would treat it with proton inhibitor, so that they think that will make your stomach not secrete a lot of acid. But on the opposite side, because I knew this is from my inherent, my constitutional digestive system's weakness.
Okay.
So if that's the case, if you do proton inhibitor, you're actually making your digestive system even weaker because your digestive system needs the acid to digest the food, to transform the food. But
Yeah.
if you inhibit the acid secretion of the stomach, you're actually weakening the digestive system. So it doesn't make any sense, right? So basically, I said, okay, I know other ways that I can treat my silent acid reflux, even though I don't have any symptoms. So then I actually started using natural alginate that you can get. You just eat the gel, and then the gel will form a layer on top of your acid so that the acid doesn't go up to irritate my throat. So after doing that for about 1 month and a half, my cough really significantly reduced. And now I've been doing it for the past 6 months, and I don't have any of the coughing problem anymore.
Um,
So that's called
Amazing.
really recognize your constitution and address your problems and address the root cause.
Yeah. And that's so helpful to hear your own story and how you were able to blend that Western and Eastern philosophies together, where it was like, okay, I need to go get a doctor to take a look at this, but then I can resolve this issue with an Eastern medicine protocol and understand that was the best way to do that for yourself and for your constitutions. What a great example. So just moving through into the kind of you have this beautiful metaphor and this kind of pulls together everything that we're talking about up to this point. The body is a garden, not a machine.
Yeah, so that's another principle I wrote in the book. I have altogether 6 principles, and I already talked 3 of them. So now this one is the fourth one. Actually, we already talked the fifth one, following the natural flow as well. So go back to the example of acid reflux. And I have treated so many people in my past 25 years of practicing Chinese medicine that a lot of people, they have acid reflux problem, and a lot of them have symptoms. They have severe heartburn, and when they lie down at night, they would have heartburn. So it really affects the quality of their life, the quality of their sleep. But most of them are on proton inhibitors just because they're prescribed by their doctors. And also a lot of them, when they get into older ages after 50 years old, they also have the same kind of problem I experienced, like the valve stopped working. So it's even getting even worse. So some people, they would actually go to the surgery route to get the hiatal hernia surgery. And I have seen so many people after hiatal hernia surgery, they still have the same kind of problem, because I don't think the hiatal hernia surgery can really fix that valve problem, because it's just a natural aging process. But and then at the same time, they're on the proton inhibitor that further weakens their digestive system. So that's the Western medicine approach, like treating your body as a machine, because they think, oh, if your valve is not working well, let's just do the surgery to repair the valve. And that's the same concept as, say, doing joint replacement. Oh, your knee wears out, so let's just replace the knee.
Okay.
But the machine, even we treat our body as a machine, we understand from all our daily life that when we buy something as the original, it works much better, even though it's a little bit wears out after years of use. The original part usually works better than the part you replace with, because the replacement part somehow it just doesn't have that kind of fit the original part, even though it looks exactly the same.
Yes.
So going back to human body, which is way more complicated than the machine or a car. So we have so many intricate systems interacting with each other. So just for a simple example of knee, if we have the cartilage worn out, and then if you do the knee replacement, a lot of times the knee replacement, the angle, the space, the surgeons, they only follow the general rule. They don't follow each unique person's joint, because each person's leg, they have certain angle, they have certain way of walking, they have certain space between the joint. And then when they do the general space, the angle, a lot of times for certain percentage of people, it just doesn't work. And after the joint replacement, they would still have so much pain. Maybe not the joint itself, but then the other area connected to that joint, they would have a lot of pain. So is it really a solution, the joint replacement? For me, I really don't think so. I think that will be the last resort if everything else fails. But of course, that comes to what I have been offering at my Colombia retreat is the stem cell, because it really helps people avoid doing the invasive surgeries for joint replacement, and then just after that you cannot reverse that if you have that surgery. And then if it doesn't work for you, then you just have to deal with it. And some people, they had to have second surgeries to fix it, and
Yeah.
even after that, a lot of times it still doesn't work as well.
Yeah.
And even people I know who had the joint replacement, they said it worked pretty well for them. They still have some kind of imbalance in the tendon, in the IT band, or different things that would still cause them problems.
Okay.
So basically, if you treat your body like a garden, first of all, you don't wait until your joints are already worn out to address that issue. Second, when you do have this kind of cartilage worn out issue, osteoarthritis, then you need to address it in an organic way, in the holistic way. And so that's when the stem cell really come into play, because they really have a powerful way to rearrange the joint inside so that you don't have that kind of inflammation, because when you have pain, it's because of inflammation.
Okay. Yeah. And we're going to definitely deeper dive into your stem cell work and your retreat in Colombia. But the question that comes to mind for me with regard to the knee replacements is, if someone had a knee replacement and it didn't go well, could they come to you for stem cell work even after the replacement, or how does that work?
So if people who already had joint replacement, then they would have some other pains, like I said, related to the angle or the space and the ligament not aligned well because of the replacement, then we can treat the other area that is causing their pain. But if it's inside that replaced joint sometimes, then we cannot do anything. However, we can definitely alleviate those side effects from the joint replacement.
Yeah, so fascinating and so helpful to know that is something that's available to people. And you mentioned that you turned 50 recently, and I'm going to be 49 in less than a month. So, and my audience is primarily women in midlife. And so this is pertinent to talk to them about exactly all the things you're talking about. We're starting to feel some of those wearing out symptoms of things happening in
Yes.
our bodies. And now things could be compounding for women that are listening. And on top of that, it's the energy, it's the weight, it's mood, it's sleep. And as we think about midlife and this critical window, what is actually happening that really makes this a tipping point for us?
I don't think there's really a tipping point, but maybe the tipping point is our estrogen decline, because our body is going through perimenopause and menopause. So to combat that hormone imbalance, then we actually need to use the natural way to make our body secrete the necessary hormone for our body to function well without having this cliff drop of estrogen. And also, if you just use the synthetic hormone or even bioidentical hormones to supplement the hormone deficiency or imbalance, sometimes it's still better that you also combine with natural dietary food that can supplement the estrogen changes going through the menopause period.
Yeah, absolutely. Hormones and inflammation in our bodies as that root driver of different disease or that chronic low grade stress, chronic low grade inflammation. People can oftentimes really not realize that's what's happening and that's what's behind the weight gain. That's what's behind them not feeling themselves anymore. Hormones are a huge deal with women. And I think the other thing too that women don't realize that I've been really trying to emphasize for people is that perimenopause can start as early as 35. And so, starting even in our mid 30s to tune into the signs and symptoms of how we're feeling or how our monthly cycles are shifting, that will help us even more to your point of getting in tune with how we feel and then understanding that so that we can be more proactive and preventative versus reactive when things start to really fall apart.
Yes.
Yeah.
And also, it's not just about the hormone decline with coming with menopause. It's also a lot of molecules in our body are declining as well. So one of the molecules that are talked about in anti-aging longevity society nowadays a lot is NAD plus, and also some proteins related to aging. And also one of the hallmarks of aging is inflammation. So chronic inflammation also creeping up with aging. So if we can manage, it's not like we can really reverse aging. I don't believe we can reverse aging, but we can certainly slow down the aging related conditions and we can still age gracefully with energy.
Yeah. Yes, absolutely. I'm all for slowing it down. I'm enjoying aging for a lot of different reasons, but I also am going to push back a little bit and do the things that will help me feel good, help me feel better for the long term. And I think that's really what it boils down to is that's your philosophy. So you talk about the oral systemic connection, and this one can be surprising for people. Can you explain that a little bit better so people understand that for aging and overall health?
Yes, because actually our oral health has a lot to do with our internal organs. So one of the main organ related to our oral health is heart. So some people they may experience a lot of dental issues and it may not again we go to the root cause. It may not just be their dental hygiene issues because a lot of people having dental issues they really pay attention to their dental hygiene very well. So why are they having these problems? Actually, it's the root cause is from the heart. And in Chinese medicine, when you have excess heart heat or even excess stomach heat from the digestive tract, that doesn't correlate to acid reflux or anything. It's more like a heat in the digestive system.
Yeah.
Then that actually can translate into the symptoms in your teeth.
Yeah.
So that actually is something I am also very passionate about, but I don't think I talked about it enough. I did do a podcast with a dentist, holistic dentist, and her podcast is called The Matter of Root. So, which really talks about this problem because it's not just your oral health, it's actually connected to your internal body balance.
Yes, absolutely. And then what brought up for me was just going back to constitution, because if your constitution naturally has more heat in it, then if you're living a life where you're bringing more heat in through your foods and your environment, that constant heat is going to continue to build in your body. And it sounds like what you're
Exactly.
saying is that's in the end, you want to try to do more cooling foods, more cooling environment, keeping your stress down, all those things that we've already talked about, which brings that all together. So I really do believe that oral systemic connection is so important. And we do have good bacteria in our mouth. And I've also heard things like not using like a mouth.
They even say the regular toothpaste have all these chemicals that are actually are not good for your oral health.
Because is that because
Yeah.
of fluoride in them?
Yeah, something like that. But I myself, I have not been using the regular toothpaste for a while. I actually use niacinamide toothpaste.
Oh, okay. That's a helpful thing to know. I'll have to look into that some more.
So you can get that niacinamide toothpaste on Amazon.
Okay, great.
Supposedly, it actually works better in whitening your teeth as well. And I just use that. I haven't had any teeth problem for a long time, but I actually have the inherent heat as well, like we mentioned earlier.
Yeah.
And also, for a lot of people to recognize the heat in their body if they have blockage in their circulation, like we mentioned at the beginning, then you think about the garden hose is clogged, then the pressure builds up. That's where the heat comes from.
Oh, I love that analogy. That's such a helpful visual. And also, I'll make sure to link the toothpaste in the show notes for people as well. So thank you for sharing that. So let's move into the regenerative medicine work that you do. This is so fascinating because, again, you're holding two worlds here at once with your Chinese medicine background, but also this regenerative science. And I'm so curious about how this works because we hear so much about biohacking these days and all these different things that we can do to help our systems. But tell us more about what your approach is and how that works.
Yeah, so I became so drawn to it because I was always interested in promoting health and longevity. And of course, before I knew anything about stem cell treatment, I always used Chinese medicine principles and apply all those principles in my own life and to people who I treat. But on the other hand, I also realized, for example, we've been talking about joint replacement and osteoarthritis of joints. So even when you are really paying attention to your body early in your 30s, 40s, there are also still chances that certain percentage of people they would still develop osteoarthritis later in their life because various reasons. Maybe some of them they are really very active, athletic, and then they did too many strenuous exercises like running marathons or even doing other things that they wears out their joints. And also can be some people maybe genetically they already have thinner cartilage on their joints, and also maybe they also have some low grade inflammation going on that destroy their cartilage. So regardless the reason, when people really get to the point that they have osteoarthritis, of course, you can use a lot of natural ways, including acupuncture, herbal medicine, and dietary to help alleviate the inflammation. But still, it's very difficult to rebuild the cartilage in the joint so that you don't have that much inflammation from your daily activity. That's when the stem cell actually come into play because initially when I was introduced to the stem cells, I actually first treated my mom. And my mom had osteoarthritis already for 20 years when she started having stem cell treatment. And she also has some other conditions related to circulation, the vein valve issues that's making her lower legs really inflamed. One of the hallmarks of aging is also chronic inflammation. So we always tend to have more chronic inflammation when we age. So how do we manage that? Of course, you can do intermittent fasting, you can increase your autophagy, and you can take some supplement to help that. But I feel the most powerful way of reducing chronic inflammation, on top of all these other things we already do, if you are very into all these things, then sometimes we still need some extra help to reduce the inflammation in our aged joints and also to help it to have more lubrication and also more prolonged, smooth movement from our daily activities. So I find the stem cell treatment for joints are really excellent because a lot of times if you take care of your body, you do the right things, you have anti-inflammatory diet, then if you add this stem cell treatment, one treatment alone can actually give you 3 to 5 years or even time of release from this type of chronic inflammation due to the aging related cartilage loss.
Okay. Wow, that is so amazing. So, in a stem cell therapy session, is this something that's injected? How does that work? And then just walk us through a little bit about what that would look like if someone came to you.
So for stem cell treatment, we can actually do many different applications. One major application we use is intravenous infusion. So that actually treats your whole body. So
Wow.
with age, we have chronic inflammation all over the body, not just say if we have a knee injury from many years ago, then that knee, particular knee, yet has more inflammation than other parts of the body. But then chronic inflammation is the hallmark of aging. So sometimes you don't even feel that much. For example, that's my example again. I actually, since I was 16, I always tended to have some neck or shoulder muscle issue
Yeah.
flared up once or twice a year. And from age 16 to all the way to maybe say 5 years ago, every single time that flared up, I either had to do a lot of swimming to resolve the muscle tension, or I had to have massage, very strong massage to release that knots, muscle knots. So I know even though I don't feel I'm that stressed, but then I do carry certain muscle tension on my neck. And then everybody, when they treat me, they say, oh, you have a lot of tension. That is also chronic inflammation.
Okay.
But I think pay attention to all these things. And I started early and I was doing a lot of swimming to help release the tension in my muscles. So I don't have very severe problems. I don't have cervical disc problem or any of that. But when I started doing stem cell intravenous infusion myself since 5 years ago, I haven't had any of these episodes. So that means my chronic inflammation level was somehow reduced, and especially in this kind of flare up situation. So the intravenous infusion actually helps the whole body. And we have people who are in their 60s, 70s, or 80s. When they do the intravenous infusion, they say their normal aches and pains they usually
Mhm.
feel are gone after that.
Oh,
So that is also because it reduces the general level of inflammation in your body.
yeah.
But
Oh my
then
gosh.
if you have a particular joint issue like hip, knee, or shoulder, then in addition to doing the whole body systemic treatment, you need to address that particular area. So that's when we do the local injection.
Okay.
And then when you have the local injection, you can actually really strongly reduce the inflammation in that particular joint. You have a lot of problem. And also the stem cells can somehow rearrange the connective tissue, the cartilage a little bit so that it may not regenerate very thick cartilage, but because it rearranged the interior of the joint. So wherever you have any osteophytes like bone spurs or any kind of some people they have certain imperfection from birth that's causing their joint problem, even though
Mm.
they're only in their 20s. But when you do the stem cell treatment, it can somehow smooth out these tissues inside the joint that are causing the friction and inflammation. So then once you smooth it out, then your joint can move much better and then it doesn't cause the inflammation.
Oh, that's amazing. And to think about not having aches and pains. Oh my gosh, so many people would jump at the opportunity to not be having to contend with those daily aches and pains that seem to just creep up over time, like you said, into as we age and even some chronic things. And so you do these treatments at your retreat center, the Zenerchi, am I saying that correctly?
Yeah.
Zenerchi, that makes sense.
Yeah.
The Zenerchi Retreat Center in Medellín, Colombia. So is that because these treatments are not happening in the US, or what connected you with Medellín, Colombia specifically?
I actually first got to Medellin, Colombia by chance. And then I fell in love with here because of the energy, because it lifts my body's energy flow somehow. So I decided to purchase a property here so that I can come here to rejuvenate my body. So I never really originally thought about I came to Medellín because of the stem cell, because back then I didn't even know about stem cell treatment. But then after I already had Zenerchi Retreat, mostly for enhancing people's energy flow, rejuvenate the body, then I got introduced into the stem cell lab in Colombia. So the reason that we grow the umbilical cord mesenchymal stem cells in Colombia is because in US you can grow them in the lab, but you can now use it clinically right now.
Oh, okay.
So you cannot apply it to, say, to somebody's knee joint or shoulder joint or even intravenous infusion. You can now use these type of lab expanded mesenchymal stem cells. So some US companies, they actually sell the stem cells that called unmanipulated. So basically they extracted from the umbilical cord after the healthy baby birth. So there were people who wanted to donate their umbilical cord. And then after that, they just extract the cells and then cryopreserve them. So they don't do any other manipulation to expand them in the lab.
Okay.
So the problem with that is if you only do that from one umbilical cord, the maximum number of stem cells you can get from that is only 25 million cells. That's the maximum, sometimes even less than that. And when we do the, say, intravenous recommended dose for any adults based on the body weight should be 100 million in one session. So that means you have to obtain the stem cells from four different just to get to that number. So that's why most people, if you do that treatment only in the United States from these unmanipulated stem cells from the umbilical cord, you just cannot get that kind of quantity and quality because they are not lab expanded and they don't allow at this time for anybody to apply these type of lab expanded stem cells in the clinical application.
Okay, that makes a lot of sense and is so helpful for someone like myself and my audience as well is not well versed in understanding how that works and how much is needed. And it sounds like it's a really helpful treatment. So people could come to Medellin and I looked up your retreat center is absolutely beautiful. It's in the mountains and it's just a beautiful place where people can literally retreat to for a week or even sounds like some people come up for a month or months to be in that space.
Yeah, so we actually had a gentleman from Ireland in January. He stayed here for a whole month because his condition needs two treatment. So you have one treatment after 1 month, you have another treatment. Then he's from Ireland. Why does he have to go back to Ireland, come back again?
Yeah.
But on the other hand, like go to the sixth principle of the book, which is we use a holistic approach in the right proportion to address anybody's particular constitution and the root cause of their imbalance, and also connect our body to nature. And I feel that it's really important to connect our body to the natural energy, like we already talked about the qi flow, the energy flow, connecting our body to the universal energy and the earth energy. So all these things are very important for somebody's balance, harmony, and health. So if we only isolate our body in the city, in the concrete building, not having a lot of connection to the, no matter how many things you do, how many supplements you do, or all the biohacks methods you do, I don't think your body can be at optimal health without these type of connections.
Yeah, absolutely. The balance, harmony, and health that you mentioned, and how that this kind of is another, in a way, it's another piece of the puzzle, so to speak. It's like we can eat well, we can exercise, we can lower our stress. All these things are really important foundationally. But if people are seeking a treatment that's really going to help them boost into this next level of helping them with aging and any concerns that they have. As we start to close here, you have a book called Regeneration Effect, Sacred Wisdom for Staying Young. And there's 6 principles you mentioned throughout our conversation today that are a part of that book. And I will definitely, of course, put a note in or put a link in the notes for people to find your book. But I'm curious if you can put in order what those six principles are for the audience.
Yes, so let's summarize the six principles. Number one is recognize your body's constitution, because we need to recognize each person's unique constitution to address each, because we cannot do one size fits all, just like Western medicine. Every pill is, if you have high blood pressure, let's just give you this pill. It's not customized, personalized, because everybody's body is different. Two people can have high blood pressure, but they have different underlying causes. So once we recognize your body's unique constitution, then we need to recognize your body's imbalance in the early stage.
Yeah.
So once we know your constitution, then we understand how your body has deficiency and excess, then how we address those things so that they are not showing up as symptoms. And then we also need to treat the root cause in the early stage. So basically, the second principle is early prevention, and the third principle is treat the root cause. And then the fourth one is treating your body like a garden instead of the machine. So we don't just switch parts and then thinking that will fix our problem. And then the fifth principle is follow the natural rhythm. So that goes again to connecting your body to the nature, to connect your body's energy to the universal energy and the earth energy. So like grounding, going outside to do the walk in the morning, in the evening to get enough even free red light without using any red light panels. So that are all helpful tips for helping your body to rejuvenate.
Yes.
And then the last principle is to incorporate everything holistically in the right proportion, particular to your type of body, to address your body's conditions.
In closing, where can women find you, learn more, or explore working with you?
So, for your audience, if they're interested in learning about the six principles, I actually have six pamphlet books, which is easy to read and to understand. Each one is only 30 pages. So, if you want one ebook for free, that particular one is Tend Your Body Like a Garden, you can go to gift.regenerationeffect.com.
Okay,
And if you
gifts.
want to order all the six pamphlets or even the abridged version 100-page book, and then the big one, the 400-page book, I'm still working on it, editing it, so it's not published yet. So you can actually order the six pamphlets book at shop.regenerationeffect.com.
Okay. So
If you
once,
want to pre-order the big book coming out, you can also pre-order it at book.regenerationeffect.com.
okay, got it. So it's book, shop, or gift. So,
Yes.
and then regenerationeffect.com sounds like.
Yes.
So I'll make sure I'll tag those also again in the show notes. And I think that so many people are going to really enjoy this conversation and gain so much wisdom from what you're offering. And I really hope that they reach out to you and learn more about these six principles because they are so vital to literally crucial to our vitality, crucial to our life, our aging, and yeah, people can benefit from it greatly. So, do you have anything else that you wanted to share before we sign off?
I just hope people will keep reading about these six principles and thinking about them because, like we said earlier, it's not very easy to implement for a lot of people. Sometimes they do it for a little bit, then they forget about it.
Yes.
So, we really need to keep reminding ourselves about these six principles and also anything beneficial to our particular body, you need to do it consistently. It's not like you just do it for 1 month, then okay, it's all set. It
Right.
doesn't work that way. So everything has to be consistent.
Yes. And that is part of my training is in lifestyle medicine. And that's one of the things that I oftentimes am working with women on too is this isn't a week or a month. This goal is to really help this become your lifestyle. So that consistency is so key. So thank you for my note on that. Thank you for also bringing your wisdom, your expertise, your knowledge today to your wise self with Sarah. I'm so grateful to have this message going out to my audience. And thanks again for being here, Dr. Song.
Thank you for having me here and giving me the opportunity to share the six principles with your audience.
Dr. Yi Song, thank you. This conversation gave me so much to think about, and I know our listeners will feel the same way. What stays with me is this: your body is not a machine to be fixed, but a garden to be tended. And midlife, as uncomfortable at times as it can feel, is actually an invitation to pay attention, to go deeper, and to get ahead of what is coming before it compounds. Dr. Song's book, Regeneration Effect, Sacred Wisdom for Staying Young, is available now. And if you're curious about her work at the Zenerchi Retreat in Medellín, Colombia, I'll have all those links in the show notes, along with the ones that she mentioned for accessing any of her other offerings. If this episode resonated with you, please share it with the person in your life that needs to hear it most. And if you haven't yet, please subscribe, leave a 5-star review, and come back when the next episode is aired. Until then, tend your garden and stay wise.